My name is Deypalan from Wiedenbach, and today I will be performing administration of oral medications. It is the giving of medication to be swallowed through the mouth. Assessment. Assess the appropriateness of the drug for the patient. Review medical history, allergy, assessment, and laboratory data that may influence drug administration. Assess the patient's ability to swallow medications. Verify patient name, dose, route, and type of administration. Assess the patient knowledge of medication and procedure. If the medication may affect the patient's vital sign, assess them before administration. If the medication is for pain relief, assess the patient's pain level before and after administration. Objectives: to ensure that patient metabolizes medication without feeling of nausea or vomiting. To offer the most common, easiest, and least expensive route of administering medication. To provide a sustained drug action and increased absorption time. Equipment: medication in disposable cup or oral syringe. Liquids such as water and juice with straw if not contraindicated. Medication cart or tray. Medication cart.
Gather equipment. Check medication order against original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations as if those ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration at the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification of the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and help prevent errors. Explain procedure to the patient to gain cooperation and to allay anxiety. Assist the patient to an upright or lateral position. Swallowing is facilitated by proper positioning. An upright or side-lying position protects the patient from aspiration. Administer medications. Offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Liquids facilitate swallowing of solid drugs. Ask whether the patient prefers to take the medications by hand or in a cup. This encourages the patient's participation in taking the medications. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside unless the nurse has seen the patient swallow the drug. The drug cannot be recorded as administered. The patient's chart is a legal record. Only with the physician's order can medications be left at the bedside. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Leave the patient in a comfortable position. Check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effect of medications.
Evaluation. Patient is able to ingest and metabolize medication without feeling of nausea or vomiting. Patient emotionally accepts medication. Desired therapeutic effect is obtained. Experiences no adverse effect including allergy response, systemic effect, or injury.